Good morning, everyone, and welcome. Today is Monday, June 8th, 2026. This morning, we are gathered for a work session. We, the Board of County Commissioners, are convening as the Board of Social Services for our quarterly update that we received from our Larimer County Human Services staff, which we greatly appreciate. My name is John Kafalis, Chair Pro Tem, joined by my Commissioner colleague Kristen Stevens. Commissioner Shattuck McNally is away. We also have our County Manager at the table, and of course our Assistant County Manager is here as well, Lorenda Volker and Lori Cadridge. At this time, we have a full agenda, and so I will pass it over to our Human Services Director for introductions, and we get to meet some new strategic leadership folks.
Thank you, Commissioner. Good morning. Again, Heather O'Hare, Human Services Director. We do have a lot on the agenda today, but before we start, just wanted to see if there was anything missing or anything that you wanted to add for today's discussion.
Commissioner Stevens, do you have any input or?
I do not. I think we're good with what we have on the agenda.
I have an item, but Lorenda, do you have anything? I'm curious if it would fit into today's agenda to have a brief discussion about what's happening with the June 1st deadline for work requirements as it relates to, I think it's mostly Medicaid folks or SNAP folks. I know there's a bit of confusion about how those work requirements are playing out, and perhaps you folks have some information or insights regarding that. That would be the only item that comes to mind for me, Heather.
Okay. I think we can, I think we'll talk through that when we get to the timeline for the 1429 legislation. We can include that.
Thank you, ma'am.
That's a good addition. Okay. And then if time allows, and I think you might see me being a bit more structured with the time today because we do have a lot, but I would love to wrap up with 2 highlights of staff accomplishments that are not on your agenda, but we'll see how time goes today.
And I would reinforce that it's always good to hear new and good things, so let's make an effort to hear those 2 highlights.
Sounds good.
Thank you, ma'am.
Okay, so we're going to, you see before you a few new team members. We've had some changes on our team, so I want to make sure we're going to spend about the first 20 minutes so that you can put faces with names and hear more about their background. And then the core services plan, we will talk through and why that's a more structured agenda item before you than it has been in the past. We'll make sure to give you a CCAP update, and then we'll spend quite a bit of time talking through the legislative update, but really focusing on House Bill 261429. Okay, so over the last couple of months, we have made both some structural changes, but then also changes to the team. So I'm going to cover this slide and orient you to the structural changes, and then I'll turn it over to each of the team members to do introductions to themselves. Kayleen has been on the team for quite some time, but I don't know that we ever did an introduction to Kayleen, so I'll give her the opportunity to also tell you more about herself. And then Thad and I, but in terms of the structural changes, you can see here that we have consolidated down to 3 divisions. So previously we had an aging and adult services division that was dedicated to the handful of program areas that serve our older adults or adults with different abilities. And we have made both the strategic and I think unfortunate decision that as the funding for those programs continues to decrease or stay flat, continuing to have them as a standalone division just is not cost effective. So the specific changes there on the left, long-term care Medicaid is the last bullet. They were previously under the Aging and Adult Services Division. The majority of their specialized caseload is long-term Medicaid generally for older adults or adults with different abilities. But they also serve children. They do have a broad caseload. And with the changes that you will hear coming to our eligibility programs, it actually makes more sense to have them aligned and under the same leadership as the rest of the eligibility programs, so that they are continuing to stay in the loop and move forward as best they can with those changes. So long-term care Medicaid moved into our Benefits and Community Support Division a couple of months ago. Then under FAD Paul, for children, youth, and family, the last bullet there, you can see adult protection. Adult protection was in this division actually up until 2018 or 2019. Many counties actually structure this way because they all have a similar focus on the protective services. So we are transitioning the adult protection teams over to FAD's division actually this coming Thursday. So that's the last step of this transition. And then under our Operations and Organizational Development Division, that last bullet there, the Office on Aging. This also was the structure up until about 2018. The Office on Aging and all of the sort of sub-programs that Aaron Alt oversees within that office are going to be under the Operations and Organizational Development Division. A lot of their work is actually working with contracted partners in the community, and so aligning them with our contracts team and our procurement team. They do a lot of work already, and so having them under the same leadership makes sense. And they have been in that division for a couple of months also. So those are the structural changes. There is one missing piece here. Hannah Ditzenberger, who you know is our policy analyst, she is home enjoying time with her new baby. She is also part of this team and will continue to monitor legislation and rule promulgation and all of the policy elements that she has had within her role. Any questions on the structural changes before you hear more from the team?
Commissioner Stevens, any questions? Yes, I have one, hopefully quick question. I'm curious, what prompted us after 2018 to move some of these services the way they had been previously, configured to the Office on Aging?
So we made the change previously when Laura Walker was the director and I was the deputy director at the time. We had some adult protection prevention funding, and so we were trying to build out a prevention arm for older adults. And really there was not, I would say, a strategic future plan for how we serve older adults. So that division has done a lot of work, really with the Office on Aging leading it, partnering with CSU and doing the strategic plan that they developed over the last couple of years with some ARPA funds. So that work will still continue. It's just the reporting structure that looks a little bit different, but we didn't have that strategy or really that holistic service approach developed at the time.
Okay, and actually, there's one more quick follow-up, please, and that is, by moving these services to what you just described, it seems like for the folks overseeing those divisions, there's an increase in workload and responsibility. How are we handling that, or is that an issue or a non-issue perhaps?
So it's not, it is an expanse of technical knowledge, I would say, although each of the division managers have awareness of the programs and the requirements. We have been very intentional, though, to make sure that we have the capacity. These teams really roll up to deputy division managers, and maybe Thad can speak to how we've built that capacity for adult protection. But really for the other two, it did not look very different. So we've made sure that there's capacity in their direct reports to be able to supervise these teams. And our deputy division managers generally have one deputy to 50 staff. And so there was capacity to realign this in that way.
Great.
But we can speak more to the adult protection because that was a little bit different.
Thank you very much. Please proceed.
Okay, so I'm going to hand it over to Shannon to tell you more about herself, and then we will go through the following slides from there.
Good morning, Commissioners. Shannon Reef, Deputy Director of Human Services. It's so good to be back. I actually worked for Larimer County Human Services and Larimer County for 12 years. So I started my work in child protection, working on the family assessment and planning team, and then moved into supervising foster care and kinship care. And then I did a little foray into IT services as a senior business analyst and then the enterprise portfolio manager before coming back to human services as the operations division manager. So I served in that role for 4 years. And then most recently, I've been gone for about 5 years. I worked at a technology startup company called Sigbee for 3 years. And then the last 2 years, I've been at Healthcare Policy and Finance as a strategic consultant for them. So I'm just so excited to be back. It's like coming home and riding a bike and also drinking from a fire hose, learning all of the changes and everything that's happened. And I'm just really pleased to be back and be a part of the team again. So thank you. So I will hand it over to Kim Moeller, who is our new division manager for benefits and community support.
Good morning, Commissioners. It's strange to be sitting here looking at you in this meeting and not in some kind of suicide prevention capacity. So I just left the Alliance for Suicide Prevention on Friday, and I'm here. I have spent the last 13 years specifically in suicide prevention work, working with the Alliance, but also at North Range and working community-wide. And I knew that I was ready for another challenge and an opportunity to grow and expand, the care that we're offering to the community. And so I am honored to be able to be a part of this team and look forward to working with you in this capacity.
And Kim officially starts with us this Thursday, so we are grateful that she's joining us a little bit early for this opportunity. And you know Thad, but I'll have him speak just a little bit to your question about APS.
Phew, I'm glad we don't have to go into the long story about how long I've been here. 29 years. I started as an intern 29 years ago at the county. So real quick, adult protection services came back into child, youth, and family. Again, as Heather mentioned, they were within our division 5 or 6 years ago. Part of how we're managing the structure of the capacity issues, we actually had, so Jonathan, this guy over here, left. He ran away from my division, went to another location, so we had a vacancy. And so through that vacancy, we filled that vacancy with Marissa Scranton, who was a supervisor, but we are not filling her supervisory role, so it created a little capacity on the number of staff. And so Marissa Scranton will be the deputy over APS, and so she's talking about learning from a fire hose. That's the space that she just started to step into. She's got a long history in working in child welfare. She'll be great, but we created some capacity through staff reductions that we've been doing from a budget containment model, if you will. So from a capacity perspective, we're in great shape. It's just a whole new learning curve for somebody that hadn't had APS history in their back. We have some great supervisors that we'll be able to lean into, though, to manage the work.
Okay, next, Jonathan.
All right, good morning, everyone. Jonathan Anderson, newest division manager of operations and organizational development. I am new to this role, but like Thad said, not new to the agency. I'm going on 19 years with the county. Came up through the child welfare system, but over the years just really found myself always running towards the projects of the operation division. And so it just felt like when it opened up, it was the right move for me. So here I am and excited to do it.
And like I said, Kayleen's been on our team a couple of years, but Kayleen, anything you want to share?
Hello, good morning. Nice to be here today. Kayleen Rowley, Business Operations Coordinator. Lived in Florida, worked for the U.S. House of Representatives for over almost a decade, and then decided I wanted to leave the heat and humidity, and decided to just cross-country travel to Fort Collins and settle here and still be involved in government work. So very proud to work for Human Services and with you all as well. So thank you.
Okay, thank you. So we will, we use this, so as a new commissioner will be joining, new commissioners in the future, we use this really as the guide so that you all know who's on our team and have sort of the programs that roll up to each of the division managers. So we can send that to you as a separate PDF also so that you have it available and can see which program rolls up to who, as you have questions that might come to you from community members or state departments, so that you know who on the team is the best person to speak to it.
I think, Heather, can you speak just for a moment, Kayleen's role with grievances and civil rights issues? That may be one of the ways that the commissioners might deal with Kayleen.
Yes, thank you, Lauren. A very good call out. So Kayleen supports the team and specifically is our point of contact for complaints, grievances, civil rights, the Child Protection Ombudsman's office. Kayleen is the point of contact, gathers all of the information, and then coordinates and organizes it across the staff that might be involved. So she works very closely with Melissa and Brenda, things that might come into your office, then get forwarded to Kayleen, and then she helps keep those. There's varying timelines, varying requirements, but Kayleen is our point of contact for those issues that might come up, or as you get questions on what the process is. She also does the annual reports that we're required to do for the different state programs to report on those complaints and grievances. So Kayleen is the go-to.
Great.
For that.
Thank you, colleagues. Commissioner Stevens, anything you'd like to add at this moment?
Just thank you and welcome. What a
Yes.
great staff you have. And Thad presented at the CCI conference. Just wanted to acknowledge that around budgetary concerns and things that we're looking towards, and it was very well received, and just wanted to shout out Thad for doing that presentation and really kind of making sure our state partners are aware of what we're all facing, what you were all facing on the ground, and so, but yeah, really happy to have all of you, and welcome.
Thank you.
Thanks, Commissioner. I was counting on you to include those grateful comments, those appreciation comments. Let us continue, please.
Okay, so the next agenda item, Thad's going to walk you through the core services plan. So recently, you all made the decision to decommission the Larimer County Interagency Oversight Group as one of your boards and commissions. But there is a key requirement that is still in place where you all need to approve the core plan. So that normally would happen through LCIOG and then come to you on the consent agenda. That process still looks the same, but Thad's going to walk you through what's in the plan, where the requirements come from, just so that you have a better sense of what's in that plan and why it will be coming to you likely next week or in the coming weeks on the consent agenda.
Great. You're on, Thad.
Thank you. Again, Thad Paul, Division Manager, Child, Youth, and Family, and Adult Protective Services. I need to add that on our division title, apparently. So, again, Heather just kind of set the framework really well there. We're coming before you today. What will happen is in about a month, you'll actually see the core plan come across your guys' desks for a consent agenda consent agenda signature to submit to the state. That's not due until about August. And part of the challenge is we can't be ready to deliver it to you yet because we actually don't know our official allocation for core services. We'll cover that in a little bit. It's funny, we're going to get our allocation after the year's already started, so it's a nuance the state does, but it is what it is. So we will kind of do a really high-level walkthrough. You know, the plan is something along 30 pages, so there's a lot of information in there, but really that 30 pages really represents defining what all the different service categories are. We won't go into that much detail today, but we will kind of cover some highlight items. So kind of starting with the statutory and regulatory framework. In essence, I don't need to read off the statutes and the volumes, but in essence, we have to submit a core plan every year to the state that allows us to draw core dollars. Most of those dollars are state dollars, but they do have some federal dollar mixed into that, and most of the allocation is an 80-20 allocation, 80% state federal, and then 20% being ours. There are some allocation line items that are 100% funded by the state or the feds. So in essence, we have to have this to actually gain access to those funds. Core services, by definition, is really intended to make sure that to support keeping kids at home safely, get them back home as quick as possible. So achieving permanency or maintaining in the home. That's really by definition, the purpose. And you can do a wide array of different kind of programs within that service bucket. Ultimately, the state requires a few main bucket items, main light items that they require all counties to have. It includes mental health services, it includes intensive family therapy, substance abuse therapy, sex abuse therapy are kind of some of the examples. They are very specific categories that have to be in every plan. The beauty is they do allow counties to be very innovative in how they develop their service array in the community. So you can not do a whole lot in one bucket area. Like, for example, we don't do a lot of service in intensive family therapy because we do a lot of really individualized mental health intervention. So it does create a lot of flexibility for us. We can go to the next slide. Oh, sorry, I have the controller. I could have had that. So when you see that come across your desk in about a month or so, you'll see two plans. There's a main core plan and then there's the core 2 plan. So the main core plan is the bedrock, right? That's the one that we have to submit to allow us to draw down the state and federal dollars. And it's going to have it actually will have all of our different service types in that same main plan. This is, as I just mentioned, an 80-20 cost share. For the most part with a little bit of 100%. We also submit, as part of every year's submittal, a core 2 plan. And the reason we do that is we expect to overspend our core allocation every year. It's not sufficient to appropriately support the community and the families and the children in need. But by submitting a core 2 plan, what that does is it actually opens up the door for any unspent promoting safe and stable families dollars in the state to be reallocated to the counties that have a core 2 plan. So for example, this last year in our core 2 plan, we received $195,000 in addition to from unspent PSF dollars across the state that came back to help support our efforts locally. So we do a core 2 plan every year. It is kind of it's an innovative way to kind of maximize all the resources that we can in our community. What I might highlight when you see this come across your desks in a little while is that there is a pretty substantial reduction in core allocation this year, about a $6.7 million reduction. What they're doing is they're moving 6.7 from core over to the child welfare block. And we can get into more details later on if we have time for questions, but in essence, it's a break even for us, if you will. We aren't losing we aren't losing our share of that. It's just showing up in a different part of the allocation, and we can cover that in a little bit if we do have some time for questions. Heather?
Why don't we will put that on our agenda for August when we bring our fiscal review to you. We are hoping to get your approval to not change our spending habits, though, and so we'll talk through in August why that's really crucial, because it impacts the federal drawdown, but we can make sure that that's on the agenda with plenty of time in August.
Yeah. So, the slides are different than what was, okay. So the core services landscape, to provide a little context, so in that bucket, in that section below, you'll see kind of the main focus areas that we're required to do, but up above, you'll see we contract with 39 different contracted agencies, 92 distinct service offerings, and in state fiscal year this year, our projected expenditures is $4 million, and our base allocation was 3.7, and then we received that additional 200,000 from PSSF reallocation. So our spending is almost dead flat this year. Historically, we've always overspent our core services, oftentimes because we get closeout from other underspending counties. The challenge is the fiscal landscape in the state is such that there's way less available for fiscal closeout, and so we have to be much more prudent in how we spend and managing that spending because we can't rely on the bailout, if you will, from other counties. We can go to the next slide. Boy, there's some pieces that went out. Okay, so what I would say is, maybe I wanted to highlight real quick is that we have seen a substantial reduction from our spending over the last several years. We've gone from 5.4 million spending in state fiscal year 23 down to the 4.2 estimated this year. So some that might be a bit of a shock, but what that is really intentional, trying to align ourselves because of that lack of closeout dollars available. And we are making shifts from a personnel perspective, much more than from a service perspective. I wouldn't say the reduction means that we don't have the need in our community. The need still exists. It is still very present, but we're just not funded appropriately to help support the families in the way we have been able to do historically. So we're being very creative in how we do that, and reducing our spending in places that are non-mandated, if you will. So moving to kind of walking through some of our main kind of buckets in our core service plan. The biggest one, and it's probably I would say our top investment for sure, is family time. People used to call family time supervised visits, right, or parenting time. This is really the service that is intended to make sure that kids that are not living with their parents or their primary caregiver full time have access to one-on-one time with their parents. And so we have 8 contracted agencies that help provide this service. It's about a little over 1.1 million of our core service allocation goes just to this one service category. And ultimately, it is a mandated service that allows us to show to the courts that we're making reasonable efforts. But fundamentally, it makes tons of sense, right? Kids and families deserve to see each other. That bond is the essential component of success in any child welfare case, and that bond actually creates a motivation, if you will, for parents to continue to do all the work that they have to do as part of their case treatment plan. I'll pause there, see if there's any questions as we're moving through.
Thank you.
Yeah.
Thanks, Thad. Commissioner Stevens, any questions? Well, I'm afraid I have 1 or 2 questions. Just to go back to the slide where you talked about the core action plan and then the
core two.
Core 2.
Mm-hmm.
Can you give us just one example of how those two are complementary?
Yes, they are. What I would say is they are honestly the exact same service type that shows into both plans. All it says is the core 2 plan is our anticipated overspend in a certain service category, for example. So I'll say, let me use family time, for example. We $1.1 million is what we're using in family time. About 800,000 of that shows up in the core 2 plan, in the main plan of how much service, and then we say we need an extra $300,000 to do this right. That shows up in the core 2 plan. So they're complementary in that the services show up, the exact services show up in both plans. It's just to make sure it's that we know that we're going to overspend our core allocation, and it is to open the door for us to have future federal reimbursement from the feds, additional funding, if you will. That makes sense?
Yes.
The way it complements is exactly the same. The family doesn't have an experience of, this is a core 2 plan service or a main core plan service. The services are identical. It's just how much money we say we're going to fund out of the main core plan versus the core 2 plan.
Thank you.
Yeah.
And this question might be best at the end of the presentation, but I was curious regarding, I think one of the services is intensive family therapy, and I think that's an example of a type of therapy that relates to what we're trying to do with the passage of House Bill 24-1038, Intensive Behavioral Health Services. And if I remember, the Colorado System of Care implementation, which I participate in, my question is how that's unfolding and how we are beginning to serve kids, and we have the Work Capacity Center here at CSU. How do you see that, and what are the implications? And one thing, Heather, Thad, and colleagues, I recall that when we began advocating for that, and there was an allocation for the services, we were talking about kids with incredibly co-occurring needs, and there was no place. There were either social workers or human services folks were with those kids in the offices, or we had to send them out of state because we didn't have the proper facilities and residential treatment and all that. So it's all tied into that. At some point, maybe at the end is best if time allows.
Covering that now? Yeah, I would say, so as part of our core plan, ultimately in our core plan, we also have to highlight here which of these services can be funded by other sources in your community, and so that is identified. So Medicaid is, like, for example, substance abuse treatment in our community. We do very little core service funding because Medicaid, Summit Stone funds the vast majority of that service. So very similarly, if there's a service category that can be funded by some other source, core service is intended to be the funder of last resort. So we are maximizing all those other funding sources before we say we need to leverage core service, either because the wait list is shorter with this provider or it's the right service type and they don't have access to that through another funding source. Now, I would say our high acuity, like there's a lot of work still happening across the state in the behavioral health need, and the reality is we have 2 children out of the state right now, still in out-of-state placements because the capacity isn't such, or the expertise isn't such in the different provider networks to actually manage some of their challenging behaviors.
Thank you. And in terms of additional dialogue, I'll defer that to the end of the presentation. And if time allows, maybe we can have a bit of a conversation about your response to that and where things are at. We can move on, please.
So the next one is kind of 3 buckets of services, if you will: family meetings, coaching, and trauma services. So these are all services that are paid for via core services. So family meetings, that is fundamental to our work. We have a whole team that facilitated family meetings to ensure that the family's voice is the driver of our casework, if you will. They're an objective facilitator. Their intention is still to help move the case through to have a successful conclusion. And we do about 1,300 family meetings in any given year with that team. And you can have as many as 2, a parent and 1 support show up, and you can have as many folks show up as 30 folks show up to a family meeting. And really the family meeting is fundamental to our work because it is designing the support network to help support the family so that there's not a reliance forever on the services that we are able to bring to bear. It really is the support network that becomes the safety mechanism to supporting families after they move out of our system. Coaching is the next. So family meetings and coaching are our next 2 highest levels use items, if you will. Coaching is uber flexible, and it really allows the service to meet kind of the independent needs of the families. As I mentioned earlier, we have 39 different contracted agencies, 92 different service arrays. The reason we have such a wide range is every family is different, every culture is different, every need is different, and so we maximize the right agencies to help support. And coaching is one of those that is the most flexible, that allows to, wherever the family in need, they can kind of pivot and move and help supporting their successful conclusion of the child welfare case, but much more importantly, the successful risk mitigation and safety mitigation within the home. And then trauma services, we were a leader in the state in our trauma work in child welfare. We have CSU, Human Development and Family Studies, doing our Resilience Alliance assessments still. And we have lots of differing trauma services that are available in our community: eye movement desensitization, equine therapy, trauma care coordinators, and then trust-based relational intervention, which is delivered by lots of community partners, which is a really grassroots, fundamental, easy to understand caregiver support from a trauma lens. So we're doing a lot of work with both our caregivers, our foster and kin, as well as biological family in the trauma service arena. Go to the next one. The last few buckets, if you will, that I would put things into is kind of the behavioral health bucket, as you mentioned there, Commissioner, juvenile justice and youth, and then the targeted supports. There's lots of varying needs that might show up from a family's lens, and that can include, as I mentioned earlier, substance abuse treatment, specialized evaluations like offense-specific evaluations, intensive family therapy, very flexible mental health services array. So there's lots of things that kind of show up in the behavioral health, and they're kind of very nuanced, so they don't each own their own service category. They kind of get lumped together. The next one there is the juvenile justice and youth. So in the state of Colorado, probation services, juvenile probation work really doesn't get any service dollars to help support those kids being successful in the community. So if you will, the highest risk youth that are on juvenile probation often get referred to DHS to help support, to maintain them in the community. One of those interventions is family partnerships. It's a program we designed about 10 years ago. It's actually a published program. We had CSU research it, and it was published in peer-reviewed journals for its success and efficacy and keeping kids out of the prison system. And you can see some of the other examples there: multi-systemic therapy, offense-specific treatment, day treatment, and then targeted supports. We do a lot of support from a hard supports lens, if you will. So my electricity's being shut off. I don't have access to any resources. We need to pay for some hard service, or I ran out of groceries, or, those kind of things. Oftentimes, hard supports also looks like transportation, the transportation challenges for our families in getting to all the required services and meetings and whatnot is a pretty big ask for families, and so that often gets utilized as a hard support, if you will. And then that's it. 20 minutes-ish.
You did great, Thad. Thank you.
Any extra questions? Anything I can
Yes,
answer?
let's see. Commissioner Stevens, questions, comments, observations?
No, I don't think I have any. Look forward to, seeing that item come before us in admin direction to support this work, but it's good to have an idea of how this is done and what that is.
Lorenda, anything before I offer a comment or a question?
I just want to say, maybe this is one of those unintentional good side effects of I guess LICOG was a very effective group, but this board didn't get to have this level of detail about these programs. And so this is a real good opportunity for you all to understand more about funding, how it works, and what the plans are that we fund. And so thank you for that. And I know walking us through it probably felt like slogging through mud, because you know this stuff and it's all kind of newer to us, but much appreciated. I think it really shows where the investments are being made in the community and why these changes are being made on our behalf. Thank you.
Thank you, colleagues.
So just really quickly, before we move on, I want Thad to speak to sort of the future state of LCIOG. The group is still convening, very active, and while it is not connected to a commissioner's board or commission, Thad will speak to where they're headed, and then how we will keep their work connected to our Board of Social Services and might bring additional items in the future.
And if I may, thank you for that comment, Heather, because one of my questions was related to the interagency organizing group, the LICOG, because we just had a presentation at the State Board of Human Services on Friday regarding the collaborative management program. And I believe at the July meeting, July 10th, we will be likely approving the allocation. And there have been less general fund dollars, but there are more fee dollars. But I think in the end, we'll have the same amount of financial resource. I was a little bit confused about the LICOG will continue, but the board or whatever we're calling it will not. Thad, please.
Yeah, so LCIOG still for our community is providing the function of our CMP board. It's just not a county commissioner appointed board. So in most counties across the state, actually their collaborative management program is not a county commissioner board. It is outside of the county commissioner. They are also still our core service, what we call as our core services board. And so because they're still looking holistically from the community, what is the service array, what is the service gaps, and they're helping to inform our core services plan. And so yes, they are still actually very connected to this work. It's just they're not an appointed board, so that's why we're bringing the core plan to you guys. What I also wanted to highlight that I forgot to cover real quick is that we do a yearly research with CSU, Social Work Research Center, to do our review of all of our core services. So from that same context, we make investments in good outcomes, not just making investments for investment's sake. So I did want to highlight that as part of our yearly process, we do an evaluation every year. Actually, CSU does the evaluation to make sure that we're not biasing the results, and then we use that evaluation to help inform future planning around service array.
Did that answer your question, Commissioner?
Yes. Does time allow to talk a little bit about the high acuity needs kids and how that relates to the Colorado system of care and the effort to train more people in order to do things like the behavior out there, and also things like high fidelity wraparound services. I mean, and I think my understanding is the intent is to keep kids at home, but be able to bring a coordinated effort to meet their needs.
Yes, why don't we go to that now, because we're going to shift gears pretty significantly to other topics.
Time allows,
Yes, yeah,
Okay.
we're doing great on time. So, House Bill 241038, as you mentioned, was a piece of legislation that is still being implemented and intended to expand the capacity to serve the the whole need of children that we call high acuity youth. So oftentimes they do have co-occurring challenges. There may be a behavioral health, there may be a developmental disability, there may be substance use. There's often a lot of things happening, but really, from the family's perspective, that parent is unable to care for them safely at home. They are often the highest utilizers of congregate care or facility settings. And so House Bill 1038 came about because there was really a significant lack of services and placement options for those youth. And so there were several $1 million funded into the system as a result of 1038. What I would say to expand on what Thad has shared, how it relates to our core plan, it really is sort of a braiding and blending approach, if you will. 1038, and there have been subsequent legislative items since then, is trying to expand the capacity and the different revenue sources, but also making sure that there are treatment providers available. So there's a really significant workforce component to make sure that across the state, there is adequate treatment providers in all of the different modalities and all of the different systems issues that a child may be experiencing. It's also intended to expand the placement continuum so that if that child can't stay home, there is an option in Colorado where they can be cared for. But it is also intended to expand all of the different payment options before it gets to core. Or when that child goes home, core may then help support that family with services once that child is home. So it's really intended to maximize Medicaid, maximize other behavioral health treatment dollars through the Behavioral Health Administration, like Thad said, so that core is the payer of last resort. But it's really intended to have all of the different service options, treatment options, placement options, so that a county, when that child is in our custody, a lot of these kids are not in county custody, they're in the custody of their parents. So the county is trying to navigate this, or unfortunately, an individual family is trying to navigate this. Making sure that the best service plan and treatment plan can be braided and blended so that that child gets what they need in their home community, or at the very least in their home state, so that then that family can walk through that treatment so that that child gets what they need.
Thank you, Heather and Thad. Not surprisingly, you did an excellent job of summarizing what the intent was of that process and that legislation. So I think that's very helpful for folks to understand. And I'm wondering, I don't know if this is adding to your capacity issue, but just like we do with State Board of Human Services, it would be nice if Thad or someone could take a look at the agenda. We meet every 2 months, the Implementation Advisory Group, and I believe the next meeting is July 16th. And every 2 weeks, we get an email, and if we have questions, and I'm happy to say that one of the co-coordinators of that working group is your colleague over in Weld County, Human Services Director, who's like you, and she's always asking the right questions. But if there's anything that I need to know, because a lot of this stuff is out of my pay range.
So what I might suggest, maybe Thad and I can meet with Amy Martones. Thad meets regularly with Cindy Dodds from Summit Stone, but I do think that we're a little bit different than other counties in that we have a broader group that's working on behavioral health, not just for youth, but across the age span. So why don't we connect with Amy and Cindy? We'll look at the agenda and we'll make sure that you have all of the comprehensive information before the next meeting.
And if there are questions I should be asking.
Yes.
Thank you very much. Please, let's move on.
Yes, happy to, we will get that to you before the July meeting. Okay. Shannon is going to provide you with a quick update on the Child Care Assistance Program.
Thank you, Heather. Shannon Reef, Human Services Deputy Director. We have just a brief update on the Child Care Assistance Program today for both funding and enrollment. So we implemented back in February of 2024 an enrollment freeze. So we've been on that freeze for about 2.5 years. And that has resulted in a 40% reduction in children being served by this program here in Larimer County. In this current fiscal year, 25-26, we continue to be on this enrollment freeze, and we are anticipating being underspent for this particular program. One of the things that's complicating, that is a complicating factor specifically related to this program that has historically been underfunded and continues to be underfunded, the Department of Early Childhood is planning this year to reduce this allocation amount, the total appropriation for the next fiscal year, 26-27, by $20 million. They currently overspend their appropriation by $39 million, and they use the let me get this correct here, the Child Care and Development Fund reserves to be able to fund their appropriation, and they're anticipating a cliff in 2028. And so they're planning some mitigation strategies now, and one of those mitigation strategies is that $20 million total appropriation decrease this year. So what that means for us in Larimer County is that for the next state fiscal year 26-27, that starts on July 1st, that we estimate a $1 million reduction in our allocation. So we will continue to remain on an enrollment freeze for this particular program.
I think one piece I would add, David Aero from County Attorney's Office is working with several of our county peers on a legal review because we have flagged, there is a procedural concern that counties have flagged that we don't believe the department has the authority to reduce the appropriation by 20 million. It's a very complicated strategy that they have put together. They cannot reduce the appropriation without utilizing the Child Care Assistance Program's Allocation Committee. When the new department was created, we were very strategic and really because of Commissioner Kafalis and I and our direct advocacy through CCI is the reason that the allocation committee is in statute because of reasons like this. And so they are trying to reduce the appropriation without agreement from the allocation committee. And in statute, it says that any disagreement between the department and the allocation committee has to go to the joint budget committee. They are trying to write that authority into rule as we speak. So you all issued a letter to Dr. Roy a couple of weeks ago about the complicated child care assistance program rules that they are promulgating. They're trying to add that authority into rule in a very vague way so that it doesn't initially show a contradiction. But David is participating with Weld County and Jefferson County and a handful of other county attorneys to do a full review because there might be a legal issue with them reducing the appropriation by this much without agreement of the allocation committee. So there may be more to come that we will bring to you in the next couple of weeks.
Great, thank you. Commissioner Stevens, do you have questions? I believe you do.
Just have a couple questions. So, the estimated $1 million reduction, do we feel like that, and clearly that's up in the air with what you said. So, do we feel like that's something that would continue in outgoing years? So we're underspent a little bit, I think, but, you know, as far as like even opening up a waiting list, like without knowing what funding looks like, it's really hard to think about what that does because don't most people get sort of once you're on, and then you get like, you know, if you have an infant, I mean, that's at least 5 years of funding that you would receive, maybe.
Yes, once a family comes on the program, we are not allowed to remove them, nor would we want to. But once they become eligible and receive the program, they receive it until either their income changes and they are above the 85% state median income, or that child reaches 13. So CCAP actually covers kids up to age 13 if they need it. The reason we are staying on a freeze right now, we are about $1 million underspent. And so it does look like our state fiscal year 26-27 allocation will be our allocation ongoing unless something significantly changes in the state's CCAP plan. And so we will still be right at our allocation and spending for next year. Because we're $1 million underspent now, but we're going to lose $1 million into next year. And when we shift to a wait list, there are 4 populations we have to prioritize. Unhoused families, and I'm going off of memory, so on an early Monday morning. Unhoused families, families that receive temporary assistance for needy families, services, children with special needs, and I think teen parents. So there are 4 populations that then we have to prioritize, and they bump to the top of the list for the wait list. And so we're always analyzing what is our volume of those 4 populations, and then trying to make the best guess of when we might open up a wait list to be able to at least move those families onto the program. The other issue, there are a handful of counties that are going to a wait list now. The level of administrative work to shift from a freeze to a wait list is significant. They have developed this very complicated scoring matrix to try to then score the families that fall within those 4 prioritized populations to figure out who we serve first. And we also then have to rework all of the applications for the families on our freeze list within 40 days when we make that change, and we have close to 1,000 families on our freeze list. So to change to a wait list is also very administratively burdensome, that then will also cost us. So trying to analyze all of that makes it complicated in terms of timing.
Does the tax that Larimer County voters passed help the situation? I don't know that those funds are getting out at this point, but will it be helpful to some of these families who, are not receiving any help at this point?
Yes, so Northern Colorado Kids Thrive, formerly Early Childhood Council, is a big portion of what they're developing and programming are subsidies to families and expanding that significantly. So they anticipate having that ready in full scale for 2027. So the timing, I think, is good. And there will be more families able to access subsidies through that funding source that might have received CCAP in the past.
Sorry, this will be my last question, but will they prioritize funding in a similar way that we would to that, what you said with the wait list, unhoused people on TANF, special needs and teen parents, or do we know yet if they?
The way that they've developed the subsidies previously using some of their existing funding and some of the ARPA funds that the county has provided them, there was a prioritization. And so they're building that out now because the sales tax funding will expand the resources significantly. So they're reworking some of that to make sure that they're strategic.
Great, thank you.
I have a couple of questions on this matter. Thank you, Shannon. So first of all, I think in light of what you just described regarding the complexities of going from freeze to a waiting list and where we are with the uncertainty regarding funding, we have really no idea when we might do that.
When we would move from a freeze to a wait list. My hope is in the next state fiscal year, we would make that transition.
Really?
To at least open up a waiting list. How quickly we would serve the families, though, I don't think we can estimate that.
Okay, thank you. And yes, my other couple of questions are, when I looked at that 4th bullet point, I caused my eyebrows to go up a little bit. And I'm wondering, the 20 million reduction, was that part of the long bill and therefore included in the department's budget request? And what kind of discussion occurred for them to justify doing such a reduction when we know that it's such a need? So was it in the long bill? What kind of, through the legislative process, what kind of debate, discussion, constructive there was to understand better the logic behind this or the justification for doing this? So that's my next question.
So there has been a lot of constructive discussion about this. My opinion is that it was not as transparent with the Joint Budget Committee as it should have been. Their budget request does indicate a reduction in appropriation, but it does not include the exact amount. We've raised that with the department. They disagree. They feel like their conversations were very transparent with the Joint Budget Committee. They did not, and we have gone back to the transcripts for the hearings and the briefings with the Joint Budget Committee. They never said on the record that they were going to reduce county appropriations by 20 million. They did say we have a structural budget issue where we are spending more than we get from the federal partners, but they never really pinpointed an amount. So that is something that we continue to raise with Dr. Roy.
This was
disagree.
part of the budget bill, the long bill. This
No.
would, it was a separate, when they were approving the budget, one of those, and satellite bills or something.
And so as Shannon said, it's called the CCDF funds,
Yeah.
Child Care Development
Yeah.
Fund. It pays for more than just CCAP. And so they are overspending the CCDF federal block grant by $39 million each year more than they receive. And so we are also asking a lot of questions to make sure that they are reducing spending in other areas where they spend it separate from what they appropriate to counties.
So last comment question, related to that, by overspending mostly the federal dollars, 39 million, what are they doing with that money, and is it serving more kids?
No, they are not serving more kids.
So what are they doing with that money? Or is that another one of those $39 million questions, perhaps?
Well, they have not been able to articulate
Okay.
how they have become, their budget has become so out of whack.
Okay.
The number of children they are serving has actually decreased. So when the department was created in 2022 or 2023, they were serving 10% of the eligible population. They now estimate they're serving 5 to 6% of the eligible population. The problem, though, is that they had some really significant audit findings that they were out of compliance with how they paid providers. So they have increased how they pay providers significantly. For the last 2 years. There is a third round of provider payments that's supposed to increase again this October, but they have asked for a waiver from the federal partners because they believe the methodology that they now use has fixed the issue and they don't need to implement that third phase of payments. So that's what has increased the cost, which has then reduced the number of kids being served.
Well, closing comment is that it seems to contradict what the JBC did last year to do that. Wasn't there like an additional 15 million or so that went to the CCAP program? So it seems to contradict that. And then also I wonder if part of the justification is that the Department of Early Childhood, they oversee the Colorado preschool program, and they have a dedicated revenue stream, and they are serving more kids in the preschool program, so maybe that's their thinking, perhaps.
And the
That's a
preschool
comment. You don't need
program
to-
receives 3 times the funding that CCAP does.
Okay. Well, thank you for engaging in the dialogue.
Yes,
More to come, I hope.
yes, more to come, for sure.
Thank you, colleagues, for accommodating me.
Okay, so moving on to our legislative wrap-up. We tracked, I think, close to 100 bills, not unlike years prior. I've taken a little bit different approach with the wrap-up and really just provided the full list of what bills passed that are most impactful. But I wanted to spend most of our time talking about House Bill 261429, but I've provided the full list, and we'll touch on just a couple of other bills before we get to that one. But the budget challenges, the state budgets forecast was worse than anticipated, so additional reductions were made that honestly helped some pretty significant policy changes that counties have been advocating for a couple of years, but unfortunately is also impacting even more significant Medicaid cuts in this year, but also in the next 2 to 3 years. In terms of human services funding, we continue to be underfunded across almost every program area. But like I said, there were some really significant policy changes that were made to temporary assistance for needy families and in child welfare that I will touch on. The JBC appropriated an additional $17 million for Medicaid to help us make the change to the administrative work that's coming as a result of HR 1. So we have seen the projections. We anticipate that for Larimer County, we'll receive an additional $1 million for Medicaid administrative work, and those work requirements are still to come, Commissioner, to your earlier question. So the work requirements for food assistance the deadline has already passed, and that was last November. The work requirements for Medicaid is October 1st of 27. And so we're in this sort of gap where we are already seeing changes for food assistance, but still trying to plan and prepare for the Medicaid work requirements. So those work requirements come next October in 2027. We actually, several months back, we shared with you that we were kicking off a community-driven project with our American Public Human Services Association partners, APHSA, one of our national partners. And this Wednesday, we actually have our first convening. I think we have about 40 different community partners that are coming. And the intent is with the convening this Wednesday, and then we will have another full day session in July where we are going to build a 12 to 18 month action plan for how we adjust to those work requirements, how we adjust to also some of the other changes, the immigration changes, but also some of the service changes. Medicaid is not going to cover the same services moving forward as part of the budget cuts. So the plan in that 12 to 18 month roadmap, if you will, is twofold. One, that we are trying to still increase access to these programs so that if you are eligible for food assistance or Medicaid, you know what the requirements are and you can receive the assistance, even though that is not the intent of the federal changes. But then also for individuals that then receive food assistance or Medicaid, Medicaid allows you to volunteer and meet those requirements. So how can we scale volunteer opportunities in the community? How can we scale work opportunities so that people can still receive the assistance from those two programs and meet those requirements? So that's what we're doing. And we have several community partners that are focused on specific populations. So work requirements for older adolescents, but also work requirements for the 60 to 65-year-old population are entirely new. And so we have community partners that serve just those populations that are coming to the table to help us think through what is our local action plan to adjust to these changes, all with the objective that our community members can still receive the services from the programs. The piece that is changing now, though, with Medicaid is that there is a subset of the population that now has to recertify every 6 months instead of every 12 months. And that's what the $17 million is appropriated for, is we have the subset of the population where the workload is going to double in order to recertify them for Medicaid. And that starts, those notices are they actually went out last week. They were starting to go out in June.
Thank you, Heather. I think that's what I was referring to, that seemed like there was a clamor in the email regarding June 1st, and what you just described is the recertification process. They'll have to do it every 6 months Is that correct? And that's an administrative load, and there's a bit of confusion around all of that. Is that correct?
There is a lot of confusion for a couple of reasons. It's only the expansion population that this applies to. So it doesn't apply to the other population. It doesn't apply to long-term care Medicaid. It doesn't apply to children. It only applies to the expansion population. And there are times that one household has someone who belongs to the expansion population and others who receive Medicaid that don't. So some people in the household will have to recertify and go through the paperwork every 6 months, whereas the rest of the household, it may still be every 12 months. So there is a lot of confusion and a lot of additional messaging coming from the State Department trying to clarify that. But that will also be the plan with our community partners, is to make that clear.
Thank you. I'm glad we're on the same team. Commissioner Stevens, any additional questions or insights, perhaps?
Thank you.
Okay, Lorenda, you have anything, ma'am? Yeah, that's an appropriate response.
So the way that I've listed the bills, again, these are just the ones that we tracked that are most impactful. No surprise, the longest list is for child welfare. The very first bill on the list I wanted to touch on because that was our priority bill that we submitted to CCI, and it did pass. So that makes a really significant structural change to the financing, actually that Thad spoke to in the core plan, but in other areas. House Bill 1075 changes the process. Without this bill, all of the federal prevention dollars that Colorado drew down went to the Department of Early Childhood. This now separates it so that if the child welfare system under CDHS is actually the one that is contributing to that activity and getting the reimbursement, then the funding goes back to child welfare. It does not go to the Department of Early Childhood. So as Thad has been working through an impact grant with our behavioral health, from our behavioral health department to scale motivational interviewing as an example, we should then, or the child welfare system should be able to draw down that prevention funding, not the Department of Early Childhood. So it made a really significant structural change that should help draw down additional revenue coming from federal prevention sources. A couple of others I would touch on, House Bill 1347. We have been talking about Social Security benefits for youth for several years. Our team, Thad, staff from Jonathan's area, as well as Hannah. Hannah put in a tremendous amount of work into this bill. We engaged in stakeholder meetings from the 2025 session all the way through this session, and the bill landed in a pretty good place. It does make significant changes, though, that we will have to adjust to. And we, when we saw this coming prior to the legislative session, really, I think we submitted a grant application to the Colorado Office of Disability Opportunity. We submitted a grant last fall and just received word that we are receiving about $230,000 specific to figuring out how do we expand the services for this bill, so that we can develop the best practices and the processes to figure out how to do this right and then share this with other counties. So we'll be working through that, but it does make significant changes where we will be screening far more children for Social Security benefits, and then going through that process and figuring out then what happens to those funds once they receive those benefits. The other two I would touch on, I'm sorry, just the last three there very quickly. So Senate Bill 188 is also related to high acuity. Commissioner Kafalis, to your earlier question, there was a bill last year, and I don't recall the bill number, but it intended to delay a pretty significant shift for that same population in how Medicaid pays for those placements. The state departments did not do what they needed to, and so this is a bill to delay it again one more year. They want to move residential placements into the capitated Medicaid payment, which then will force counties to pay a lot more because Medicaid won't pay the portion that they are today. So Senate Bill 188 and my counterpart from Weld County, Jamie Ulrich, is participating in the implementation plan for this one. So we will make sure that you have that information and it stays very connected to 1038. But this will delay, again, another significant shift in what Medicaid pays for those residential placements. House Bills 1374 and 1373 make some very unfortunate policy changes, but also very fiscally needed policy changes, where it changes the amount and the process that we are paying for kinship placements and adoption and relative guardianship subsidies. So it caps the subsidies so that it is not paying at the same level, and repeals prior policy changes that were made that increased the costs for those programs pretty significantly. Then there were two specific bills focused on older adults that we were tracking pretty closely. We don't anticipate really significant operational changes or programmatic changes from these, really because, again, Hannah worked very closely with several other counties to make sure that the parts of the bills that we were really concerned about were revised. And then in our economic security and poverty reduction programs, there were another handful of bills that we tracked very closely. Senate Bill 181 is a really significant bill that makes changes to temporary assistance for needy families. That certainly impacts both of you. Commissioner Kaffa says you are on the state board. It changes the cost of living increases that were coming to the basic cash assistance payments. But Senate Bill 181 really is the list of policy changes that the Works Allocation Committee with Commissioner Stevens has been asking for several years to try to figure out the fiscal sustainability for TANF. It is not a Band-Aid fix. This is more like a tourniquet, if you will. It slows the bleeding, but there are still really significant changes needed to TANF to bring fiscal sustainability to that program, so there will be a lot more coming. And then House Bill 261429, that certainly was the largest piece of legislation. So in October or November of last year, we learned that Healthcare Policy and Financing and the State Department of Human Services included a budget item through the governor's budget request to completely restructure the system, create regions across counties where one county had fiscal and performance oversight over other counties. There was a lot that was of concern in that proposal. A lot of changes were made to the bill in what finally passed from what was proposed initially. And that is the result of all of the negotiation conversations. So thank you, Commissioner Stevens, for your hours and hours of work spent in those negotiation meetings. No county will have fiscal oversight or performance oversight over another county in the future state. So that's a really significant change. And you all have heard me say there are changes that are needed to the administration of these programs. We have been underfunded the entire 11 years that I have served in this leadership capacity. We are projected to be close to 40 million overspent in the administration of these programs in this current year. So continuing to say that the system should stay as is and continuing to ask for that much more money from the Joint Budget Committee is just not, I think, a smart request, but it's also not feasible that the state's fiscal challenges are going to be able to fund it in that way. So, and to adjust to the HR1 changes that are coming, but also there are some really significant gaps of counties doing all of the work that they are required to do. And I understand why counties have made choices to not meet some of the requirements when we're not funded to do all of it. But the vast majority of counties are not doing quality assurance, are not doing fraud investigations and recovery of payments that have been made inaccurately or to families who are not eligible. That puts the entire system at risk, particularly as we think about the changes coming to the programs in the future. So these changes also make shifts so that it hopefully ensures that every county is doing what they need to, or there is a bit more teeth than in the oversight and in the accountability from the state departments to be able to address that differently. So what the bill includes, the bottom section there is just the high-level bullet points of the significant changes. So it is going to centralize the fraud and recovery tasks, or what we call program integrity, where the state will oversee one contract, and it will be a competitive process where counties can compete for that contract, and then they will be responsible for doing that work statewide. So that's what we're calling the centralization of that service. And that is, we are working on that competitive process and what those requirements will be. So more to come on that. The remaining bullets, so outside of program integrity, there is opportunity then for counties to share in the rest of the workload through what is called cohorts. So there will be no more than 12 cohorts, and that's really as defined as they've gotten. So there will be up to 12 cohorts or up to 12 groupings of counties that can share work. So very similar to our partnership with Grand and Jackson County, where we administer their CCAP program. We share in that, and it alleviates a lot of the training requirements that they have. They have been unable to hire and retain staff in that program and then make sure that they're trained up to the requirements. Whereas we have a team of staff who are very long tenured, really love the work, but they also have lost some of the ability to work new applications while we're on a freeze. So they're working new applications for another county. So it's a very mutually beneficial relationship that ensures that for the 3 counties, the families are getting what they need for CCAP. So that's just one of many examples. Significant technology enhancements and data transparency. So we will be required to report data to the state every month. The state will be required to publish data on public dashboards across all of the programs. But there are significant technology enhancements coming to CBMS and then all of the sort of connected tools that make CBMS work. It requires a state and county continuous quality improvement committee. So that is actually kicking off this Thursday. I have been identified as the county chair for that CQI committee. We are starting this Thursday. It is already developed for food assistance for SNAP, and then we have until September to add on a CQI process for CCAP, for Medicaid, for TANF, for all of the other programs. But that one is certainly well underway. There's a policy alignment team where all 3 state departments will be required to have policy decision makers on an alignment team so that when they are telling us that there is this change to applications that has to be aligned across all of the program areas rather than very siloed and very specific to that program. The state will also employ regional managers, so up to 1 regional manager for every cohort, and that really is intended to be that programmatic and that policy oversight and accountability to counties, so that the state has more resources to actually provide the technical assistance and the oversight that they are responsible for. And then the JBC set aside $3.1 million for state fiscal year 26-27 to kick this off and start implementing these initial pieces. So you have in front of you a timeline. This next slide that you also have is just the same information, but in a bulleted list, if it's easier to look at it that way. We are working right now on the process to identify a third-party contractor. So the third-party contractor is being hired to actually lead and facilitate the implementation team that will include Commissioner Kafalis, do a lot of analysis of other models and other states that have found efficiencies and cost containment and bring those elements back to Colorado, do fiscal modeling to figure out what is the cost that is needed for the system, and then facilitate the development of that implementation and transition plan. So Shannon and I will be working on a small team with a handful of other counties to review those applications and then participating in the interviews. They are utilizing a list of vendors that have already gone through the state's procurement process to be able to speed this up. And many of those vendors Shannon has experience with or insight with from her previous role with HICPUF. So we wanted to make sure that we were included in that small team so that we can provide that expertise. And then as soon as that third-party vendor is selected, and July 1st is the deadline, that's when they should be kicking off the implementation team meetings. So we should know more here in probably the next 2 to 3 weeks of the meeting cadence and structure and format of those meetings. There were 6 county representatives, so Commissioner Kafalis, Commissioner Pogue from Summit, Commissioner Mollica from Adams, and then Jamie Ulrich, who is the Human Services Director in Weld, Dan McKelkey, the Human Services Director in Arapahoe, and Michael Aragon, the Human Services Director in Los Animas County. Those are the 6 county reps, and then there will be someone from Children's Campaign, probably Colorado Center for Law and Policy, Gary Community Ventures, and then the state departments. So the other entities are seating the implementation team currently while we're working also on the third-party vendor. And then simultaneous to that, there is a transition plan that has to be developed between now and January 1st for the centralization of the fraud and recovery or the program integrity work, so that that is happening parallel over the next 6 months. While then the third piece is that there is development of performance-based contracts that also have to be developed by February, where there will be one performance-based contract between the state and Larimer County that includes all of these programs, rather than having 6 or 7 performance-based contracts or MOUs, IGAs. They all have very different names currently, but it will be consolidated into one performance-based contract that will have some fiscal penalties, potentially some fiscal incentives that are tied then to the performance metrics for those programs. And then July 1st of 2028 is the implementation date of all of this. So the cohorts will go live by July 1st of 2028. Most of the technology enhancements will be ready by then, although CBMS is being overhauled in 28 and 29. But a lot of the technology enhancements will be implemented by July 1st of 2028, and then program integrity will be centralized by then as well. So a lot of work to come and a lot of sort of parallel projects happening at the same time. Commissioner Stevens, anything that I missed?
No, I think you did a really good summary, and just, for those who are listening, I do think that there are some advantages to moving to this kind of program. And as Heather said, there's counties that just aren't offering some of these services, so people don't have a consistent experience across the state, right? In some counties like ours, we are able to deliver all these services and be able to do the quality assurance and that work. Other communities sometimes can't even answer their phones promptly. And so I think the consistency piece is going to be really good for the people that we serve across the state. So that I think that just being able to help some of these smaller counties with best practices and being able to share that workload and spread that out more evenly is a really important piece of this too. And then, making sure that that we didn't have one county being responsible. So that felt very onerous, and small counties just weren't really comfortable with that. And so, having the state be the heavy, so to speak, in those kind of situations where people aren't performing to the standards, counties just didn't want to be, feel like they were the sort of bully or in those kind of situations. So I know that smaller counties are happier with that. But the model that we have with Grandin and Jackson was really held up as how we're already doing this work, and how Larimer has really leaned into this work around, helping smaller counties. So, that was great to, it's always good to hear good things about the work that you all are doing, but I think it gave hope to communities that this is not impossible. And so we do have an extended timeline to be able to make sure this happens. I was happy to serve on the negotiation team. Was a good experience, but I'm glad that I can hand off some of that work to Commissioner Kafalis, but also happy to participate because, like you said, the work isn't done. The implementation team will be a 6-month team. There'll be subcommittees, there'll be other committees as we keep doing the work. There'll be committees probably to make sure that the technology advances. And so I don't feel like my job is done just because I'm not participating in the implementation part. There's a lot of work to be done, and happy to be involved where I can be. But thank you. Just really want to, if it's okay, Chair, I just want to thank Heather for, I am well aware that Heather has the expertise in this area, and I am largely the mouthpiece, and that I get sometimes put on these committees because Heather is so great at the work that she does and so well respected across the state. So I am happy to ride on her coattails in that area, and she is very good about, and yet Commissioner, as you will know, in the implementation committee, she is just a very good advocate and has stayed in touch with me, and I could always say, what do you think about this? Will this work? Because I don't want to be part of setting up a system that won't work for all of you. So anyway, that's all for me. I talked a lot. Thank you.
Thank you, Commissioner.
Thank you, Commissioner Stevens. I have a couple of comments just to build on that, if I may, and then I do have a few questions, and then perhaps our county manager would like to add. First of all, I want to publicly express my sincere appreciation for Commissioner Stevens. This particular working group, I think it seems like the working groups that she signs up for, like the works allocation or this one, it's more than what the description says and trails. So thank you for your service, and I know you were at the table, and it's great that it's a team effort. And I look forward, as we move forward in the next 6 months beyond, to working with Heather, working with Kristen or Commissioner Stevens, a tag team effort to try to make sure that we continue to move forward. So those are my comments. And I think one of the biggest outcomes, and it was alluded to, is that it slowed down the process. If I remember correctly, when the governor and his team proposed this reorganization, restructuring, the timeline was like tomorrow, and the county said that that's not possible. So I think that's a significant thing. It allows us to be more thoughtful about the process and really make sure that we're acknowledging best practices and getting in a third-party facilitator that is not necessarily just handpicked by the folks in Denver. So with that, I have a couple of quick questions, and I think we're good on time. We definitely want to hear new and good, and certainly if Lorinda or others have things to say. My first is regarding the technology improvements and you referenced one of our favorite computer systems, the Colorado Benefits Management System. Will that also require upgrades or improvements to the PEAK system, which interfaces with CBMS? Can you speak to that, or someone?
Yes, and Shannon, jump in.
Thank you, ma'am.
So it will make enhancements to PEAK as the online portal that community members go into PEAK to apply. That's really the interface that they use. And then it helps bridge the work to us in CBMS is the easiest way to explain it. So it will make enhancements to PEAK. They are rebuilding CBMS entirely because they have realized that continuing to add Band-Aids to it is not working. So that's why CBMS is going to be completely rebuilt between now and 2029. There are accompanying tools along with it. So PEAK is one. Call centers, so making sure that there is a tool where there is a call center software, similar to what we have here in Larimer, where you can more efficiently answer calls, people can get to the right place, some texting functionality, a lot of data reports to show how long it's taking to answer calls. There's a lot of work happening around a call center. But then there's also scheduling software. So if we think about sharing work across counties, Larimer County may be working on the application from Larimer County, but they may be doing their food assistance interview, say if they applied from Grand County. And so software that allows for scheduling interviews and scheduling follow-up when it's structured in that process. And then also checking income resources is another significant tool. Right now, we use Equifax for what's called the work number. It costs Colorado well over $20 million a year just for that software. So they're trying to build that into CBMS so that it's more cost effective, but also includes data from a variety of sources. So PEAK is one, but there are multiple sort of sister tools or software packages that sit on top of CBMS, very similar to PEAK.
Great. Thank you. My next question is regarding you referenced the CQI, continuous quality improvement, and I think you said that with regard to the SNAP program, that's in place. And so with that understanding, is that why we recently received good news, maybe it's been a month, regarding payment error rates as it pertains to SNAP eligibility? Would you speak to that, please?
So we've received good news of our payment error rates.
Oh, that's right. Yeah. That's right.
For October, November, and December, which is the most current data we have, Larimer County's payment error rate was 0, which is that's really significant for a large county. Our team does a fantastic job. But it's all of the county's payment error rates then that rolls up to the statewide payment error rate. We are making progress in the statewide payment error rate. And what I would say to that is twofold. Right now is the very small window we have to advocate to our congressional delegation. While they are still reviewing and debating the Farm Bill, that is the only vehicle we have to delay this cost penalty to states, because we are currently in the measurement period that will determine what our fiscal sanction is that starts next year. So the Farm Bill is the only vehicle to make that happen. So CCI, as your association, as well as the Human Services Directors Association, sent a joint letter to all of Colorado's congressional representatives asking them to advocate for the delay in this cost shift. And the most significant reason to delay it is that we had the government shut down last fall. We were already in the measurement period, and we were already, 100% of the cases were inaccurate and will count towards the error rate because the government shut down, right? So we weren't getting the benefits out, which then creates the error. So right now is the window to advocate that the cost penalty be delayed. And we are seeing a reduction. The last I heard, Colorado's statewide error rate was right around 8%, which would put us in the second tier. We would still have about a $70 to $100 million fiscal penalty that the state and counties will have to figure out how to share. But that's down from, I think we started at 11% of an error rate. So it is a significant reduction, but we have to get down below 6% in order to not have a fiscal penalty.
Thank you. Just two more questions. And your responses generate more thinking about this, but I think it's best to not get too much into the weeds on this. My next question is that okay? You mentioned the implementation working group and the 6 county representative folks and state and all, and then some of the CBOs, or community-based organizations. And the list that you shared of groups, I didn't see one that was specifically addressing the needs of people with disabilities. How is that being addressed? Or did I miss something, perhaps?
No,
Okay.
probably the only tie would be through Colorado Center for Law and Policy. They do a lot of advocacy around long-term care Medicaid, which is, and a lot of the individuals that they advocate for are part of that community. This shift, though, coming about from House Bill 1429 is not going to address the other change that impacts that community, and that Medicaid is going to pay for less in the future because of the state budget constraints. So that community, that population, unfortunately, is going to be impacted by both because they are having to make significant cost reductions to Medicaid. And so they are making significant reductions then in what Medicaid pays for that impacts a lot of individuals in that population.
So with that in mind, Heather, I would respectfully suggest that we make sure that in terms of whatever input we may provide to this process, that the issues and the needs of folks in the disability community are holistically are being addressed. And also, going back to your previous comment about the Farm Bill, and that a letter was sent out to the federal folks, CCI letter, have we heard back from any of them with a real response? And is there perhaps a follow-up advocacy need on the part of folks like Commissioner Stevens, because they all listen to what she has to say?
I know we received additional questions from Evans's office. Specific to Larimer, they also reached out to Adams County asking about our error rate. What was it today? What has it been for the last 5 or 6 years? But other than that, I don't know that we've received a response. So I don't think a follow-up hurts for sure. But I can double check today to see if the Directors Association or if CCI has received a response and let you know.
If you would do that, please, and then perhaps offer, if there is a need for us to get re-engage a little bit on this, maybe there are some talking points that we need to communicate in terms of the Farm Bill and what needs to happen to delay the potential penalty, cost penalty.
Yes, we can get that too.
And finally, when you mentioned about, the shared services, and Commissioner Stevens certainly referenced this regarding our track record on CCAP and working with the other 2 counties, we have a track record here, and we've been pretty good at it. Does that suggest if we decide to submit an application for the RFP for being the county that oversees some of this, that puts us at a bit of an advantage? Not necessarily.
So the only, at least based on what we know today, how the cohorts get implemented, there really is not any more detail. I think that will come from the implementation team. Okay. The only RFP that we are aware of today, though, is for program integrity for the fraud and recovery. I have not. I think there's 2 pieces that give me pause about applying for that. One, I do not believe that the state will be able to fund that contract in future years and keep up with the cost of administering that contract. So I think we would continue to run in the red, probably from day one. We see the same thing with the Child Welfare Hotline that is centralized in Prowers County. They increased the rates of what we pay to Prowers County to use the hotline because the state is not keeping up with the cost of the contract. So that's the biggest reason. And I also, we do not experience a really significant return on investment for that work. When you do a fraud investigation and then you recoup those payments, the county is able to keep a certain percentage of the funds that are repaid. The percentage varies by program, so, but we have a really strong team that does that work, and we can never get caught up. There's always a backlog, and the recoupment, I think, is only going to go down as federal changes are happening. And so budgetarily, we will always run in the red, and then we will be responsible for the work statewide. I initially would recommend it is not a good idea, but there may be more information that changes that recommendation to you.
Thank you kindly. Your recommendation is well understood and I think valid cause for making sure that we're, as always, very thoughtful about this. Thank you. Lorenda, do you have anything you'd like to add or perhaps some questions?
I think no questions, but very briefly, we've talked a lot about systems and dollars and cost and those kind of things, and I don't want people to lose sight that these are the programs that support the most vulnerable in our community. And so the money that is given to counties to administer these programs is really important because people are at the heart of it, whether it's our people who are administering the programs or the people in the community who are receiving the benefits. And so I don't want that to get lost because we've spent a lot of time talking about the business of administration. But I know this team really focuses on the people, and I just don't think that maybe got heard as much as it could have today. We aren't doing this in a heartless, thoughtless way.
Yes,
Absolutely. There's a story behind each data point.
yes.
Thank you, Lorenda. Commissioner Stevens, anything else you'd like to ask or add before we move into the next part of the presentation?
No, let's celebrate some folks.
Yes, let's do that, please.
So we are going to wrap up. There is accomplishment from our team every single day in every program. There are two that we wanted to make sure to highlight today. And 1 second, this might have gone to sleep. If you can go, there we go. So Commissioner Stevens mentioned this, but FAD presented a fantastic presentation to the Child Welfare Allocation Committee last week at the CCI conference. And it was, so this presentation was requested from Commissioner Warren Goley, who is the chair of the Allocation Committee. And she learned pretty quickly that FAD had sort of cracked the code on how to track the cost of child welfare legislation. And so this was highlighting, and we will send you the PowerPoint so that you have it. This was highlighting 4 legislative items in particular that have been implemented over the last 4 or 5 years, but showing the tens of millions of dollars that have been just absorbed by counties because there's not sufficient funding or the accurate amount of funding that was projected in the fiscal note. So THAD worked across multiple large counties to gather the data, to verify the data, and then put together the fantastic PowerPoint that we'll send to you that shows when we changed kinship care, this is the cost now that we are seeing in our child welfare funding. When we changed visitation and family time with 2 prior legislative items, this is the cost. So being able to really narrow down and show when we made this policy change, this is the cost then that counties are having to absorb because the funding has not increased. And there were, So Thad presented this to a room of, I don't know, probably 70, 80 people at least. And you could hear commissioners from across the state say, oh, this makes sense now. Now I can connect what we've been talking about in the allocation committee to programmatic and asking very different questions. So it was a fantastic presentation, and it was a very heavy lift for Thad to pull it together in just a couple of weeks, but a presentation that I think resonated with everyone and will continue to resonate with that group when you see the very long list of legislative items that was just passed. So, thank you.
Fantastic. And I presume that that presentation would also be shared with our budget team, because they are often, like someone like Matthew, Alex, and Josh, so they're aware of these specific examples of where there are unfunded mandates.
Yes, we will include them when we send it to you.
That can we do like a group hug or a shout out? Yay, yay for Thad. Let's go on to the next person. Or
All right.
persons.
Shannon's going to highlight our child support team.
Oh,
All right, so we received 3 awards
whoa.
at the Colorado Family Support Council Conference in Loveland, just early last week. So the first award we received was recognition from the Colorado Department of Human Services for meeting all 3 of our state goals for child support. The second award was also from Colorado Department of Human Services for meeting all 4 of our federal measures, which is fantastic. And then in addition to both of those, the Colorado Family Support Council Conference or Board awarded Larimer County as an outstanding large county for 2025. So congratulations to that team and all of their hard work. And these are some amazing accomplishments.
This is a team of about 28 staff, and they collect close to $20 million of child support every year that then goes back out to custodial parents and the children in our community. So it's tremendous work for a large team, but really to collect $20 million. It's a pretty small but mighty team when you think about the fiscal impact.
And I assume that includes gambling proceeds as appropriate.
It includes that, the unfortunate part of tax intercepts. I mean, they also, there's a lot of challenging conversations they have when they're suspending people's driver's licenses. They have a really tough job to help explain to a non-custodial parent why paying their child support is so impactful to their child and why they should still do it, even when there's very often a very tumultuous relationship with the custodial parent. So they have hard jobs every day, but their dedication and their work on behalf of those kids stands out.
Great. Thank you, Shannon. Thank you for sharing that. Is there anything else you folks wish to present? Otherwise, we'll see if we have any closing comments, and we'll adjourn.
I think that's it for today. So in August, we will have our fiscal update. So we'll make sure to go into more of the weeds on the core allocation change that we talked about earlier, but you'll have sort of a closeout of our state fiscal year and then what our allocations are for next year. And then probably 1 or 2 other, we'll make sure to have House Bill 1429 will be on the agenda for the next probably year and a half, if I had to guess. So that'll be a standing agenda item, but if there's anything else that you all would request, just let us know.
Wonderful. Thank you. Well done, team. Commissioner Stevens, do you have any additional closing and inspirational comments that you wish to offer?
Oh, now I got to make them inspirational as well, right? Pressure is on.
Yes, please.
Well, first of all, really, there again, Thad's presentation and the data that he collected to show the impacts of that legislation was very well received. I mean, yeah, there was probably close to 100 people in that room, and everybody was very surprised, and it was great to just see that, because we always talk about those impacts, but to actually have them have a dollar amount associated with those impacts is really important. It was so good that I texted Lorinda and I was like, "That's doing this," and I don't always do that, but I try not to be on my phone too much, but I was like, "That is like doing this presentation, and it's so amazing." But I do think that we need to share, as we think about, we've had the legislative meetings with our legislators, like before the session starts, kind of, late summer, early fall. that's really good, if we can summarize some of that data, because I will say that there's,
Good point.
and John, I'm not going to say anything against the legislature, because, I do value the work that they do. And, to continuing to increase programs, new and shiny programs, when we're really unable to do some of our basic work is just not fiscally responsible, and it's not sustainable. And so some of these newer, ideas that have been brought forward, where we've actually had to sometimes slash the funds or, not have those cost of living increases because they aren't sustainable, is really hoping to help our legislators understand that, we're in an environment where we can't create, new programs without maybe taking away some programs that aren't working as well or aren't, helping as many folks. And so I think really having some data like that is going to be really important to say, hey, I know that there's a lot of things we could do in human services that would be beneficial, and we can't give up our core mission to do, the next new and shiny thing. And people are already struggling with implementing some of these programs, like the visitation programs, whatever. Like in our jail, we were able to accommodate that because we have a newer jail. There's many places where that was a real struggle to do that. And so, really thank you, Thad, for just highlighting that. And I do think we should share it as a way to demonstrate to our legislators that, we can't continue to do more with less. And so I think that was the ultimate thing. And then congratulations to the child support folks. I'm always impressed when we do the proclamation for them, the amount of dollars that they're able to, those are dollars we don't have to spend, right? those are dollars that don't come out of the county budget, that are duly owed to the children and families that they're serving. And that's a remarkable number. And as you said, we don't hear the stories about how difficult those conversations are. But that's really important to keep in mind, is it's not only that they're getting these dollars, they're really having to explain to a non-custodial parent that, you need to pay your fair share and you need to take care of your children. And so kudos to those folks as well, and to all of you, the work that you do, really always impressed and happy to help where we can. And like Commissioner Cavallo said, if we need to write an additional letter, we need to make some phone calls around the Farm Bill, happy to do that, because I think that we really need to make sure that they understand that those error rates could be, just those penalties are above and beyond what any penalty should be for, there again, the penalties are assessed not because there's, fraud, because we're capturing where there's fraud. It's really errors that are sort of, sometimes an error by a client who's, doesn't have all their documents, so there's errors in a computer system that doesn't function as well as it should. And so there's a lot of reasons for these error rates. Most of them are not, intentional. They are accidental. And so really getting penalized in the hundreds of millions of dollars, or even $70 or $80 million is just not, it doesn't seem fair for the hard work that you're all doing. So we're happy to engage in that way. And that's all for me. Thank you, Commissioner.
Gosh, thank you, Commissioner Stevens. Well said. I'll just add a couple of thoughts, and then we'll close out with the always extraordinary wisdom of our county manager. And if our assistant county manager was sitting at the table, I bet she would have some wonderful wisdom to share. I agree with everything that, Commissioner Stevens said. Please let us know if there's any follow-up with the federal delegation on the Farm Bill stuff. That's really important. Secondly, one of the most meaningful experiences I had was when I went for 2 hours to the benefits to see all the computer screens. I would welcome an opportunity, if you all think it's a good idea, welcome an opportunity to do that again. And I'd also welcome an opportunity to observe confidentially Red Team and how that works. I'd be really curious to come back to your shop and continue to learn. The third thing, I think I want to build off of what Lorinda, the county manager, said earlier, that there's a story behind everything. Absolutely. And I also want to present that I think, to me, this highlights the need. The county has to be ready under all circumstances. And county resources, county dollars, are used to leverage these other dollars. And we are constantly challenged, especially when there are unfunded mandates. So people need to understand this work is complicated. This work is one of the core responsibilities that we have is beautiful work, and we need county resources to be able to deal with the complexity of these kinds of cases of families that are our neighbors, brothers and sisters. When we prevent a kid from being at a home, or when we help a family become more economically secure, in the end, it benefits all of us in this community, and the county needs to be able to have the resources, the staffing, and the dollars to be able to leverage other resources to get to do this work as best as we can. So I wanted to offer that, and other than to say, yes, thank you, and I will refrain later from the group hug. But honestly, totally appreciate you folks. Oh, and please let the benefits people know how much we appreciate the fact that the last quarter, whatever the heck it was, 0% payment error rate. So would you let them know? We'll bring them some donuts or something.
We will. Yes, we will share.
Actually, some oranges, that's healthier. Anyway, that's all I have to say. Lorinda, anything you'd like to share, please?
Not much left to say. I think you said it very well. You all are the faces of the entire department, and so I hope anyone who's listening really understands how much we appreciate their work. It is some of the most difficult work that counties do, and your folks do it very well. We keep getting recognized for it in various ways. I think it speaks to the kind of team you've put together, the resiliency you've been able to build, and we just really appreciate it. These meetings can be very complicated, and you're always able to break it down into something that is consumable by us and by the public. So again, thank you. Thanks for everything.
Thank you.
Thank you, County Manager Volker. At this time, it is 11:55 a.m. We are adjourned, and even more so because my watch is telling me, let's get moving. So we wish you all a good day, and again, thank you so much.
Thank you.